Tonight, some local nurses have figured out a way to help prevent healthcare worker burnout, a new tool that can optimize nursing assignments.
And that means better care for patients. 10 on your side's Amy Avery is here to explain. Amy?
Well, Stephanie and Regina, before the Patient Acuity Nursing Tool, or PANT, was developed, nurses at Sentara realized some days their workloads were uneven. Now this new tool takes a calculated approach to improving patient care and makes sure patients with greater needs are spread out more evenly among staff members.
I wanted to evenly distribute that work to all of the staff members so that not one nurse felt like they were drowning in an assignment.
Charge nurse Kristen Danley was one of the nurses who came up with the idea for PANT. It's an innovative tool that helps calculate the amount of time nurses spend on certain tasks and creates a number or color for each patient.
Things like administering medications, ambulating somebody to the restroom, placing an IV catheter.
Prior to the software, each nurse was typically assigned the same number of patients each day by a charge nurse like Crystal Stratton. But some of those patients might have had higher needs than others, and there was no way to take that into consideration without looking at each individual chart.
You might have to dig more into the charts and know the orders and know every little detail of what's going on, versus now with PANT, parts of that are automated.
The program was piloted at Sentara in 2016, then expanded across their 12 hospitals a year later. It's continued to grow and develop since then and was vital during the pandemic when they had limited resources and burnout among staff members was at its peak.
How can we still meet the demands of the patients in our community that is coming in and adjust our workload, the amount of work that we have per shift per day, to meet those patient needs.
A program for nurses, by nurses, and still providing quality care.
I still have to know a lot about what's going on the unit and what's happening with each of these patients, but at the same time, some of that work is removed because there's a number assigned, even a color assigned, so I can balance everybody's number total with their abilities as a nurse, their strong points, their personalities, the patient personalities, the things that are happening during the day, because happy nurses and happy patients is really what matters the most.
Now, PANT is receiving national recognition in the nursing field too, and they hope that this tool may also help attract new people to go into the nursing field as well, because many hospitals are dealing with a nationwide nursing shortage following the pandemic.